Hello, I'm Tu Kim Lam. Welcome to the Medical News Show from Washington, D.C. On the last edition of the Medical News, we talk about cholesterol and the latest information related to this cholesterol. On this edition of the Medical News, we'll talk about triglyceride. What is triglyceride? What is the differences between cholesterol and triglyceride? And how does this triglyceride affect our body? Here with us is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will answer some of these questions about related to triglyceride. Welcome to our Medical News Show, Dr. Tran.
Hello and welcome to our show today, and hello, Mrs. Lam.
Dr. Tran, today we're going to talk about triglyceride. Can you explain to our audience what is triglyceride and how does this fat relate to our body?
I think most people know about cholesterol, but for triglyceride a little bit different because a few people may know about this disease when they have high triglycerides in the blood. Triglycerides means, because tri means three, and the three fatty acid combined with one sugar, they call glycerol. So triglycerides is the combinations of fat and the sugar. So triglycerides is the basic smallest molecules of the fat that we eat. But when you get into the system, go to the intestine, the body cannot absorb triglyceride. And they have to rely on the pancreas to secrete the lipase, and also with a combination of bile from liver to break down the triglyceride into fatty acid again and glycerol. Now the fatty acid will be transported through to the intestine, go to the blood. But go to the blood, then they will combine with cholesterol and forming the chylomicron. This is similar to the colors of the milk. So therefore, when we draw the blood of the people with high triglyceride, and after we really centrifuge the blood, you can see how cloudy the levels of triglycerides in the sample of blood. So therefore, we can recognize these things when we get the blood from people with high triglyceride. Now, the triglyceride will move to the liver, but then they will carry out by another protein called very low density protein. That protein transport on the triglyceride go to anywhere that the body needs to provide basically the calorie or the energy for the body to use, because the body needs some kind of calorie to function. The same thing with the car needs some gasoline to run the machine and keep it warm. So I think it's that basically what we understand about the triglycerides in the blood.
So what is the differences between cholesterol and triglycerides, sir?
It's so much different between the two because cholesterol, I think is from food as well, but most of the time cholesterol was synthesized by the liver. And then recycle means the body keep using cholesterol and to build the other structures in the body, like the membrane on the cells, including the brain cells, and also help to really to build the sex hormone and also vitamin D. So cholesterol is different because they help the body to build something else in the body, but triglycerides just provide the calorie. So that's the most different between the two.
So what caused the triglyceride level rise up in our body?
The triglycerides is mostly from food. People with obesity usually have high triglyceride. But so far, people know that the researchers know that the triglyceride maybe relates to some underlying problems in the medical problem of that body as well. For instance, people with the renal failure, people with diabetes, uncontrolled diabetes, people really have hypoactive thyroid also have some problem. And people drinking a lot of alcohol also having high triglyceride because alcohol acting on the liver release more fatty acid to the system. And also, most scientists right now discover that the triglyceride may be triggered by different medication. And some of them is a steroid that we use for treating asthma or arthritis. The second group is diuretic to reduce the edema of people with swelling the ankles or swelling in the body, retaining waters in the body. And thirdly is people who really taking the medication treating for cancers of the breast. And also beta blockers, usually the very popular medication to helping with the heart problem. And finally, is to remember and tell the physician that you've been taking this medication. So when they look into this, they know this is some kind of underlying problem that may trigger high triglyceride beside the too much eating and alcohol drinker.
So what is the level of triglyceride is considered as high, and what is the average?
Yeah, easy to remember. For cholesterol, we remember 200. But for triglycerides, just remember 150. From 150 to 250 is borderline high. But from over 250 to 500 is high. It's high triglyceride. But it's the top very high is when it's above 500. When the triglycerides over 500, it may trigger a lot of complications.
Can you tell us what are the complications if the patient didn't treat on time?
Nowadays, people know for sure that triglyceride can cause atherosclerosis. This means hardening of the arteries of the body. When that happens, it may trigger heart attack. It may causing the stroke, and also causing blockage of the arteries of the whole body. That relate to the complication. Now, the second complication is quite unusual. Is when the triglycerides over 500, they may triggers pancreatitis, meaning the swelling of the pancreas. And when that happens, people will have severe pain in the abdomen, and then they maybe have nausea and vomiting as well. So that is the second complication. And the third complication is with too much triglyceride, create a problem called fatty liver, meaning it's too much fat and store and stay in the liver.
So what are the symptoms for this triglyceride level?
Symptom-wise, really, mostly is asymptomatic. People most really not aware until they get a blood test. But when it's so high that it triggers acute abdominal pain, like something related to need to be taken care of right away, need acute intervention. But mostly people with the high triglyceride, you can see around the eye some kind of yellow stuff around the eyes, small nodules around the eye, or under the skin, or around the ankles. You can see the presence of the yellow stuff we call xanthomas. Xanthomas is because accumulation of the fat under the skin.
So in terms of diet or nutrition, which food we need to avoid while treating triglyceride?
The difference between the diet and the triglycerides is a little bit different from cholesterol, because triglycerides is a combination of the fat and the sugar combined. So therefore, we have to avoid any kind of fat from animals. Trans fat means a special kind of fat that human beings create by deep fry and like butter. So we have to avoid these things, and we all have to avoid sugar. Sugar means food related to that, like bread, rice, and it's better to use the brown rice than the white rice. And try to avoid the alcohol, because alcohol also triggers some problem. Besides exercise, and exercise is always the key for any kind of treatment for related to the fat in the body.
So besides food and exercise, what are the medication that are available for treatment?
Medication really available, but it's not so many, but it's mostly the fibrate. The brand name is Lopid, Tricor, and Trilipid. This most recently. The second group is niacin. Is long history. We were using niacin to build up the good cholesterol HDL and decrease the triglyceride. And mostly people really focus more on omega-3 that found in the fish oil. And therefore, right now, most of the people and focus on that and using omega-3 because it's so safe to use them and to take care and treat for the high triglycerides.
So before closing the show, would you please share with us some of the latest information regarding to triglyceride?
The latest information really is not much really completely, it's breaking news, but people know for sure right now triglycerides play a role in causing heart problem and stroke. And therefore, to reduce that triglyceride, the studies show that we can prevent the stroke and heart attack to 44%. And omega-3 is still the number one and using to treat beside the diet with eat fish in order to bring the triglycerides down. So these are the most updated information about the triglyceride.
Thank you, Dr. Tran. That is all the time we have for our medical news. Thank you for joining us.
Thank you for listening to our show today. And again, thank you, Ms. Lam.
Thank you, Dr. Tran. That was Dr. Sang Tran, who just shared with us the information on triglyceride and the latest information regarding to triglyceride. That is all the time we have for this edition of the Medical News. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the Medical News. Until then, have a great one.